So just a few questions. So introduce yourself.
Yeah, sure. I'm Andrew Craze. I'm a GP at Manor Surgery in Redruth, where I've been for over 20 years now. I'm also the clinical director of the North Carrier East Primary Care Network, which is a small network of practices that work together.
So I'm Tamsin Craze. I'm one of the partners at Manor Surgery in Redruth.
Hi, my name's Jo Craze. I'm the vaccination coordinator for North Carrier East Primary Care Network.
My name's Caroline Pugh, I'm the practice manager at Clinton Road Surgery and Manor Surgery, Redruth, Cornwalls.
It was pretty chaotic in the beginning because there were so many changes coming through in such a short period of time that we were really struggling to grapple with what was expected of us and what the guidelines were, because they seemed to change so much. You know, looking back, I think we've all adapted really well.
And the job changed. One night you would be booking patients in, having full clinics, lots of people coming into practice. The very next day you're doing telephone triage and trying to rearrange things so you've got limited access into the building. So every single part of the working structure changed overnight, and it's a credit to the staff that actually they did massive changes and they just rolled with it. Inevitably things got a bit stressful.
Yeah, so I think it's fair to say it's been a huge learning curve for us all, having not been through anything particularly like this in the past.
I came along to help just as a volunteer right at the beginning, just to try and, just to do my bit, just to help. Quite quickly, the practice manager at the GP practice asked if I'd be interested in actually assisting her with the building of the clinics and putting the clinics together, getting the patients in and running the clinics, because she was finding there was too much to do alongside her normal role in general practice. So we agreed a pretty part-time role to start with, which has really grown from my promised 10 hours a week to over 45 hours a week.
So initially, as you can imagine, this was new for everybody. Nobody had seen this coming realistically. And so you were getting several different emails every day, and the next day you get different governance and guidance because it was all new. Keeping on top of that, as well as looking after your workforce, planning ahead, was really quite tricky.
You bring everybody together and you tell them one thing and then you weren't sure if it was right, and then you'd have to get together again the next day and say something else. And it was really hard trying to keep up with the massive volumes that were coming through. And you know, the whole mask thing, should we wear masks, shouldn't we wear masks, that debate went on for a long time. Again, you know, you look back and I don't know how we managed it, to be honest.
It's a bit like playing Mario Kart and they throw bombs at you just out of the blue, and you've got to work out how to avoid those bombs or get around those bombs.
It's taken a lot of research and hard work on our part in finding how those processes best work, and we had to do this very quickly, far more quickly than we normally would introduce such a process.
So again, the Clinton Road staff started working at our Manor Surgery. It's 3 times the size, so coming from a small semi-detached house environment to more of a clinical medical building was quite intimidating for the staff. I think some struggled.
In the beginning, nobody made any contact with the surgery. It was really, really quiet, and people who did call in really didn't want to come in. There was no desire to come in, and they were all very happy to take advice over the telephone. And actually I would say that's been pretty good all the way through. People have been really understanding. They've not pushed to come in, but they have still been seen appropriately. So I think it's about communication and making people not feel shortchanged by a telephone call, and making them realise there's still a lot of value and we can do a lot with a telephone call.
It took quite a while for that to settle down, I would say. And then there was obviously anxiety about vaccinations.
We asked if we could use it as a vaccination centre, and NHS Property Services and the local commissioning group kindly agreed to that. And that's been fantastic because we've managed to keep the whole vaccination process separate from the day-to-day working of general practice across the road.
We went quite early for Cornwall. Our first big weekend was the weekend before Christmas, so no last minute shopping, but it was all hands on. We did over 1,000 that weekend. And then straight after that, the government changed policy again, and we weren't to be given second doses then. We're going to be extended to 12 weeks. However, the patients had consented to have their first and second dose within the 3 week. So we continued, and we did over 800 of the first 1,000 on the 9th and 10th of January. And patients have been really understanding. Certainly when we did our first COVID vaccination, we had Christmas music playing, and there was such a jovial, happy atmosphere. You had all these 80, 90-year-old patients coming in at first time they'd been out, pretty much since March, coming in for their first vaccine, and it was just really quite joyous, actually. It was a great feeling. Yeah, they've been great.
What do you think is one moment or event in the last year to 6 months that you feel will stick with you throughout your involvement in this process?
Without a doubt, was the very first weekend, which was the week before Christmas, when we saw nearly 1,000 patients, I think, in one weekend. It was all hands on deck. You have to stop for a sec, because it's just making me feel up again. Sorry. It was very fast moving. It was exciting. It was the weekend before Christmas. The patients, who were all very elderly, they were all in their 80s, were elated to be there and having their first dose, and feeling that I was part of something huge, part of making history. That will never leave me.
Oh, there's that's a difficult one, isn't it? But maybe seeing my daughter take part in the COVID vaccination programme. So she's a medical student, and she decided she'd get trained up as a vaccinator. And then my proud mum moment is seeing her turn up in her scrubs, and then helping her initially, being her observer and showing her how to do the consent and how to do the injecting, and then watching her go off and do it really competently on her own, and then getting lovely feedback from patients and other colleagues about what a great person she was to have around. So maybe that's one of my lovely, that's one of my lovely memories, and I've got a nice image of that in my head.
I think it's going to have to be those first vaccines. We had virtually every clinical member of staff had 11 vaccinators that first weekend.
I think probably it was the first vaccination weekend before Christmas. That's the thing that stands out most of my memory. Because we're going into too much detail. We had originally agreed to be part of what was called the second wave at the time, so one of the earliest vaccinators, indeed only 3 days after the very first set of vaccinators, and then it was cancelled, and at very, very short notice, within a few days, we were strongly encouraged to go ahead and do this.
But the whole atmosphere, I think after the year, knowing that you didn't have a really good Easter because we had to work over the Easter bank holidays last year, we had, no summer barbecue, no Christmas meal, and then you get this weekend before Christmas where you've got all these patients really happy. So yeah, that's what's going to stick with me, I think.
When we started, I really wasn't sure how it was going to turn out. It seemed such an enormous undertaking, but thanks to just the enormous hard work and willingness of all of our staff, doctors, nurses, administrators, everyone really, absolutely everybody, and including some fantastic volunteers from the community and the commissioning group, we did vaccinate over the Friday, Saturday and Sunday. We did vaccinate well over 1,000 people, which was the highest number in the county at that point in time, and it just went extremely well.